This is Damian McNamara, Global Medical News Network, at the American Society for Dermatologic Surgery and the American Society of Cosmetic Dermatology and Aesthetic Surgery meeting in Phoenix, Arizona. And with me is Dr. Cheryl Burgess. Thank you for being with me.
Thank you for having me.
I appreciate it. Now at this meeting you're presenting a talk and discussing challenges in treating patients of skin of color and their aesthetic needs. Can you tell me a little more, like what are some of the major challenges in that area?
Well, there are quite a few aspects to why this meeting has a course like this, or a coffee talk, and it's because a lot of people have inquired, and I get calls from my colleagues, and how would you do this, or what setting would you put the laser on, or what have you, and there are differences in the skin. From the scarring potential, the post-inflammatory hyperpigmentation, and it's not as scary if you know how to handle the complications. So they're really not necessarily challenges, but I think they are, it's just information to help you along with maybe a different segment of the population you may be treating at that time. And
could you describe for me the difference in the concerns that patients might have based on the different types of skin color?
You know, when we say skin of color, we're really referring to maybe Latinos, Asians, and black skin. But outside of that, what concerns them a lot more are extrinsic and intrinsic changes, aging changes, whereas in skin of color, and more so in black skin, it's more intrinsic. You get more of the sagging and the loss of elasticity, but you don't see a lot of wrinkles on the outside. When surveyed, most skin of color patients, the major concern is discoloration. Not wrinkles, not lines, not sagging, but a certain uneven discoloration that you can see with aging as well. So that's the easy part. And then when you clear the skin up, then they see the other things.
So once they have a universal tone, then they're like, hey, wait a minute.
Yeah, wait a minute.
Are there any caveats to treating skin of color in terms of lasers or in terms of fillers?
Well, you know, one thing that when I teach my residents, I'm on staff at Georgetown, and they really do see a lot of skin of color in the clinic, but you know, when you get out in practice, you may not have the device that's in the clinic there, or you may not have certain things. So I try to instruct them to do a test spot. You know, always do a test spot on a patient and be patient. You know, you can do a post-auricular or a submental test spot of whatever you may, procedure you may want to do. So if there is some scarring, or you don't have your settings quite right, at least it's non-visible, and knowing how to correct then.
Can I ask you if you have any disclosures related to your discussion?
Yes, I do. I am on advisory to Allergan, Medicis, Johnson & Johnson, Stiefel, Merz, and Sanofi Aventis.
This has been Damian McNamara with Global Medical News Network.